look at the meds for this week. I know y'all are like taking the test tomorrow, but we'll go over them anyways. Some of these are new. Okay, so Prenavil or lisinopril, this is a very commonly prescribed medicine for hypertension. You see lots of people, you probably have somebody in your family who takes lisinopril. Usually comes in this little blue plastic case, and you just punch out pills as you go through the month. It has this little like sliding thing. So ACE inhibitor, we talked about that the other day, what an ACE inhibitor is. But it's going to limit vasoconstriction basically, so it's going to open up blood vessels so the pressure is not so much. So for hypertension, sometimes people take it for heart failure, or they can take it in an acute heart attack. So like right then, because it dilates blood vessels. It works against constricting. That's why that would help. Pregnancy category D, so it's not something they'd want to take. You know, some of these are just general symptoms: dizziness, lightheadedness, tiredness. Some of that can be caused by hypotension, because look, if it's given with diuretics, it can cause increased hypotension, you know, which is going to lower. It's just like an increased effect, basically. Zocor or simvastatin, they say that statins are the most frequently prescribed drugs in the United States, okay, which makes sense because of our diet. Yeah. And so it's a cholesterol, okay, or hyperlipidemia, hypercholesteremia, high cholesterol, high fat, a lot of fat in the blood. That's what all that means. Pregnancy category X. All statins are category X. So all of them are. All statins.
As it gets closer to Z, is it like not bad?
As it gets closer to what?
Like now it says pregnancy category X.
Oh yeah, they do seem to get worse the farther down the alphabet you go. Is that what you're saying?
Okay, so that's how you know.
But there's really just A, B, C, D, and X.
So X is the worst.
X is like, don't take this or something will happen.
Okay.
And precautions.
Experience, they don't know this from testing in like a lab.
Right. They probably tested on animals though.
Okay. Did you say all of them were all category X?
All statins are category X. Okay, precautions, limit alcohol, monitor administration with these other medications. And I'm not going to ask those specifically. Now, if there's one in particular, you know, that has like this crazy effect, then that might be something you would expect to see on the quiz or something. No Coumadin, all of these put them at a risk for myopathy. What would myopathy be? Like muscle disease. Okay, so muscle breakdown, muscle disease. Contraindications are with cyclosporin, danazol, and gimfibrazil. And you'll see that gimfibrazil a lot, I feel like. Synthroid and levothyroxine. Okay, so this is hormone replacement for the thyroid hormone, Synthroid, with, thyroid is what kind of that sounds like. So levothyroxine, thyro, again, you see it in there. It's very commonly prescribed. Lots of people have hypothyroidism. Okay. Goiter is actually a symptom of hyperthyroidism, which I know that sounds weird, but usually that's related to you get hyperthyroidism because there's a breakdown in that process later on, so this still helps you. Dose in micrograms. Okay, so very tiny doses of this medicine. That's what that MCG means, is micrograms. There's 100 micrograms in a milligram.
Wow.
Okay, so yeah.
So how do they know? How can they make it that small?
Technology. Protect tablets from light and moisture. Interactions occur. Spell that. With multiple drugs. So usually they take it 30 minutes like before their breakfast is usually when it's advised to take it because it has a lot of interactions. Supposed to take it on an empty stomach. Side effects: increased heart rate, blood pressure, respiratory rate, weight loss, menstrual changes, anxiety. All those are kind of hormone related. A lot of hormone related drugs have weight changes, depression, anxiety kind of changes, menstrual changes. That makes sense. Amoxil or amoxicillin, there's lots of brand names for amoxicillin. So don't think, amoxil is not the only one. It's a penicillin antibiotic. That's what PCN stands for, is penicillin. And all penicillin antibiotics, you can tell what they are because they usually say "cillin" at the end. Piperacillin, whatever. Bacterial infections. Any antibiotics are always bacterial infections. Makes birth control less effective. We talked about that the other day. A lot of antibiotics do that. If it's a suspension, they need to make sure that they shake it up really well before they give it. Contraindicated with any allergy to penicillin at all. Side effects: thrush, candidiasis. That's like an overgrowth of your normal bacteria. So a lot of times people get that. Nausea, vomiting, diarrhea. Do not administer with mono. I need to see what that mono is short for. I'll look that up unless it got cut off.
Mono, just short of one.
Maybe mono is the disease mono. Don't give it with mono. That's a viral infection. So
I was told that was
mononucleosis. I bet that's what that is. Just mono. Okay, a Z-Pack or Zithromax. Y'all probably all taken a Z-Pack at some point. It usually comes in like a package, and it's got pink pills, and you take 2 the first day, and then you take 1 a day for the next 4 days. Azithromycin, so those kind of sound alike. Zithromax, azithromycin. It's a macrolide antibiotic, also for bacterial infections. A lot of people take them for like sinus infections. Comes in 3 or 5 day packs. Side effects: diarrhea, hepatotoxicity, arrhythmia. Don't want to take with liver disease. Microzide is the brand name for hydrochlorothiazide, HCTZ. That'll be on your abbreviation list pretty soon if we haven't had it already.
Oh, excuse me.
And it's a diuretic. Okay, so any diuretic is going to make you lose water. That's its purpose. You're retaining water, that increases your blood pressure. So when you lose water, that decreases your blood pressure. Okay, so hypertension is the reason that it's taken. Stored in tight, life-resistant container. Side effects are hypotension, of course, okay, because that's its purpose. Dizziness, hypokalemia, okay? Hypokalemia, any ideas on what that is? Think of your periodic table. What is a K on your periodic table? Yes, potassium. So hypokalemia would be what then? Low potassium. Okay. The reason that is because most diuretics, okay, cause a loss of potassium. So they make your kidneys excrete more, okay, which makes them get rid of more potassium. Well, the problem with potassium is, you have to have potassium for your neurons to work. You have to have potassium for your heart to work. So potassium is it's a big deal if you get low potassium. Okay, so most diuretics will cause low potassium levels, and that's really important to know. And then other electrolyte imbalances, just because you're losing all those fluids. It's contraindicated with anuria. What would that be? Or anuria. And at the beginning of a word means what? We talked about anemia. I don't know. Atrophy, asexual reproduction. A or an at the beginning of a word means without. That we learned that last year. Okay, urea would mean what? Do you think? Urine. So if they are not peeing, you don't want them to take this medicine. Okay, that's the case for most medicines. But if they can't go to the bathroom, they don't need to take this medicine because that's what it's made to do. So it's going to cause some serious issues. Okay, Norvasc is, that should say amlodipine. A-M-L. Amlodipine. Not I. It's not amlodipine, it's amlodipine. A-M-L-O-D-I-P-I-N-E.
Yeah, that's what, right?
Oh, okay. I guess mine is old, so. Okay, calcium channel blocker. So it works on hypertension and coronary artery disease. Side effects: dizziness, arrhythmia. Precautions used to monitor with liver disease. Metabolize the liver. Glucophage sounds like it would be what? What are you hearing there? Glucose. Okay. So glucophage or metformin is an anti-diabetic. It's an oral medicine, so it's a pill. Okay? It's for type 2 diabetes. Glucophage, metformin, and you'll hear both of those terms. Metformin, you hear it a lot. Something that's very commonly prescribed. Adverse effect: lactic acidosis. Okay, so that would be a blood issue. Stored in light-resistant container. That's a lot of these. Monitor renal function, so kidney disease. I mean, you want to make sure their kidneys are working. And then, of course, with kidney disease, you don't want them to take it because they can't get rid of it. Acupril or quinapril. So we see the pril again, just like with lisinopril. Okay, so when you see that pril, think ACE inhibitor, hypertension. Okay, so this is for hypertension or heart failure. Pregnancy category D. Side effects: dizziness, headache. HA is headache. Orthostatic hypotension, which we said is what? Same as postural hypotension. Remember, that means if you stand up, then yeah, your blood pressure drops, or if you change positions. Okay, contraindicated with diabetes or kidney disease again.
Orthos straighten it.
Mm-hmm. Acifex, rabeprazole. Okay, is a proton pump inhibitor. So you see that prozole at the end, that clues you in that that's what it's for. GERD, you may know what GERD stands for. Gastroesophageal reflux disease. So it's what causes heartburn. Think gastro is what? Esophageal.
Your esophagus.
Okay, reflux, so it's moving back up. Okay, disease, so it's constant heartburn. Basically, it's like a heartburn disease.
That would suck.
Okay. Side effects are generalized GI, nausea, vomiting, that whole bit. Precautions when taking: you want to be really careful with Coumadin, cyclosporin, methotrexate. Specifically for this one. Okay.